I'm going to use Mycoplasma. I could have used several other pathogens that I've had the opportunity to work up partial budgets on. And by the way, I'm excited about some of the things that I heard here at this meeting because we veterinarians are using budgets. Yesterday, Clayton Johnson talked about how using the current science with the time to negative study changed his model. And I think that's exciting to me as a veterinarian, and you'll see why in just a little bit. Dr. Marie yesterday talked about Mycoplasma, and having, after a naive herd breaks, there's 70 days roughly that you're going to be fighting this organism as an acute type of an infection. So how do we put dollars and cents to this? I think that was the challenge that I got out from Dr. Kolb. And so just to briefly go over things a little bit, Mycoplasma, gosh, it's been around longer than I have. You know, we've had several names to it. Today it's PRDC because we have co-infections that we deal with so much. But it's a very, very old disease. It does attach to those villi and usually doesn't kill these pigs. Dr. Kirk Clark started doing a lot of work with Mycoplasma when he was at Purdue in the research side, and that's really where my understanding of Mycoplasma started to come in, and I started to really think about it in a little different way. Well, it does produce a cough. So today we're looking at cough as an index and saying, okay, that may be the start of the clinical signs. When did the actual infection start? And of course with Mycoplasma, it creates an environment, a problem with the environment in the trachea, and the animal cannot take those pathogens out of the airways. And of course you got other aspects. This is pretty typical of what we see when we necropsy pigs. You know, you got those kind of lesions, but they also apply to swine influenza, circovirus, and other pathogens. Well, with that, I think we need to understand the epidemiology of the pathogen as well as the cost. And I'll just go through some of it. Mycoplasma is maintained in the herd because of vertical transmission. It's very, very slow. But once it gets going, it can really cause a lot of problems, and especially with co-infections or stocking density issues, your costs can increase quite a bit. Influenza today is probably the tipping point, or PRRS, with a chronic infection of myco. But the challenge that I had in March of 2010 was to take a look at a sudden change in this guy's health status. Now, I think we as veterinarians do a wonderful job at serology, clinical presentations of disease, lesions, and even looking at performance. But my challenge to you as you leave here today is start thinking how you can start to apply cost in your monitoring on the performance side. So let's take this case. It's a 2200 single-site, multi-site unit. Been working with this producer for a number of years. The main finishing site I consider continuous flow. Now he repopulated, no PRRS, no myco, and in this case there was no influenza when we made the diagnosis of Mycoplasma. But at the time that this break happened, he only had somewhere between 2 and 4 weeks of downtime where he was not putting pigs into this site. But out of this experience, when he asked one day, he says, I wonder what this really cost me. We have developed a communication at a much different level. And today, he has found some off-site finishers. So in the course of the last 2 years, he's got more pigs and they're off-site, so we've got nearly a 7-week downtime, and that vastly improves our ability to control some things like influenza when it occurs on these farms. But March 2010 starts the ball rolling, so we look at the constraints of each unit, and that's what makes each unit so unique, in my opinion, is some of the constraints, and that's why the partial budget is helpful in a practice like mine, because we can deal with some of these constraints. Lighter market weights when health challenge occurs, Feed conversions vary due to what's being fed and the health status, and then co-infections. So we had a break, March 2010. These figures are pre-break, these figures are post-break. And this is an example of just taking the closeout records, putting them in a format that we can look at several different criteria. Mortality, average daily gain, feed conversion, calls is the 4 in this illustration. And you can see we had about a 2% increase in mortality. But a lot of producers today know how to put a dollar figure on the mortality, and they're pretty good at it because they know their variable cost and they know what their revenue is when they're selling pigs. So my challenge was about the middle of 2010 from this client was help me develop the cost otherwise. Because I think what's happening is people are beginning to understand sick pigs don't eat, and all of a sudden it takes them longer to get to market. We have developed systems that have no open time. In other words, that space is occupied and we have to turn these barns pretty quickly, and we only have X number of weeks to get that pig off to market. So when they start to slow up, summer heat's another example. What happens with market weight? Where's the opportunity cost at? And that's the illustration I'd like to give you. This is where our conversation has went since we started to develop this, this model. Before we get into it, I want to put in some SPC charting just so you can visualize some of the differences in the productions. This happens to be on covariance of the market weights. Average daily gain did decrease from 2 pounds. Now these pigs were going in at 50 pounds and coming out at 255 when this challenge occurred. But today, because of his offsites, he now has market weights in the 275 range. Feed conversion worsened, and mortality, about 2%. So when we put some of this stuff into statistics, you can start to see before and after, and I want to make a note. The amount of closeouts that we used here are a little bit different than on my previous slide that I showed you the actual figures. But we had 16 before, 9 closeouts afterwards to develop what was the p-value for each of the 3 aspects. And this helped us develop this average daily feed intake, helped us develop some of the figures that you'll see in just a minute. Now you got to make assumptions when it comes to these economics. Back in 2010, in the proceedings, you'll see about $8 we lost in this outbreak. With this illustration, this was about 2 weeks ago when I used these feed costs, but I'm using 11.6 cents, $130 revenue per pig, and I used 5.5 pounds of daily feed intake. Overhead cost, I used 10 cents. We seen earlier this morning, Noel Williams had 11, 12 cents on some of his illustrations. So I'm in the ballpark, but we actually put in there things like what's it take to turn the lights on, you know, wash down that building and so forth. This shows where we began at 50 pounds. At that point in time, we were at 255. Much lighter weight than it is today. So now you can get into, and I have a copy of the Excel spreadsheet if anybody wants to see it, but all I did is I just copied and pasted into the slides what we started to look at and what actually we worked through with the owner. So feed cost, we're going to maintain the gain the same. Let's say in this illustration, we want 205 pounds of gain. So we're going to look at feed conversion, the change, the pounds of feed that it took to do that differently, and we come up with $6.18 just for the feed. Days on feed, again, we're going to leave this at 205. Average daily gain and the change that occurred 7 days longer to market was $9.19. Talking to people like Dale Polson that does a lot of this economics on a more regular basis, days to market is a huge, it trumps feed efficiency in most of our systems today because we don't have enough floor space to handle a slowdown that occurs. So I found that interesting. Cost, overhead cost. So again, just to turn the lights on and so forth, prior, after the infection, at 10 cents, $72 or 72 cents a pig. And we add that all up, we have in today's market $16 at a cost just to handle the longer time to market, the difference in feed efficiency, and the overhead cost. This slide shows it a little differently. When I did the calculations using the assumptions that I gave earlier, we still lost $3. But because of the infection, we lost $19. So that's kind of interesting, and I haven't shown this to the producer yet because I just put this together the other day, but it'll be interesting to see that. Now please note, I did not have any cost involved with mortality, additional feed, the treatments, because we injected, to keep the 2%, keep the mortality down to 2%, we were very aggressive with our treatments and starting a vaccination program. Again, just a summary on this. The economic costs were figured in late 2010. That's in the proceedings. Today's example is showing what the current feed cost will tell us. The key is sick pigs don't eat, and we as veterinarians are asked to help monitor, prevent, control these kind of outbreaks. So how do you look at a break if you don't know the cost? If you don't have an appreciation for how long those pigs are going to take to get to market, or if you're going through a circle virus and we have 20% mortality and another 20% calls, that's an easy one to figure. We know that's a disaster. So this was the challenge for me when I put this together, and I've used this for years on doing these partial budgets, and it's kind of fun because you always see something a little different when you get them done. And using this method, I think the other take-home for me that I'd like to pass along is it opened up a whole different communication with this client. And with that, we started to, over the course of time, as he was able to gather his resources, we looked at and improved to today's standard how much feeder space per pig, how much water space, how many head per water, and the rest that comes into the competition to keep healthy pigs eating and going to market.